As a brain doctor, with years of experience treating strokes and neurological conditions, I've seen firsthand how small lifestyle choices can have profound effects on brain health, especially in seniors. But what I'm about to share might surprise you as much as it shocked me. We often talk about diet, exercise, and medication when it comes to stroke prevention. Rarely, however, do we think about something as simple and routine as the way we sleep. But recent findings have uncovered that a specific sleeping position may significantly increase the risk of stroke, literally overnight. This isn't about sleep deprivation or poor quality rest, although those are important too. This is about the actual position your body is in for 6 to 8 hours every single night. For seniors, whose risk of stroke is already elevated due to age-related changes in the vascular system, this hidden factor could be silently contributing to that danger without any warning signs. In this article, we'll explore the research behind how sleep posture affects brain circulation, oxygen flow, and pressure on vital arteries. I'll also break down the sleeping position that raises red flags, explain the biological reasons behind the increased risk, and share safer alternatives that can protect your brain health while improving your overall sleep quality. This is critical information for anyone over 60 or caring for someone who is. A small change in your bedtime habits could drastically reduce your stroke risk and even save your life. Let's take a closer look at what the science says and what you can do starting tonight to sleep safer and smarter. 1. A doctor's alarming discovery. As a brain specialist, I've treated many strokes, but nothing shocked me more than realizing the way seniors' sleep could be silently endangering their brains. It's not just about snoring or restless nights. It's about posture. There's mounting evidence that certain sleeping positions, particularly in older adults, directly impair blood flow or oxygen delivery, quietly raising stroke risk while you sleep. The latest research underscores this danger. For instance, sleeping on your back, particularly with no pillow, may worsen obstructive sleep apnea, a condition known to significantly elevate stroke risk. Discovering that a seemingly harmless, even recommended position could be contributing to nocturnal vascular compromise was a real wake-up call. 2. How sleeping posture affects your brain. Several mechanisms explain how poor sleep posture can impact stroke risk. Airway obstruction and apnea. Lying flat on your back can cause the tongue and soft tissues to collapse, blocking airflow. The resulting drops in blood oxygen and surges in blood pressure injure vessels and heighten stroke susceptibility. Vascular compression. Some positions exert pressure on key arteries supplying the brain, like vertebral arteries. There are even case reports tying elevated pillows to spontaneous artery dissection, dubbed Shogun pillow syndrome. Blunted nighttime blood pressure dip. Normally, blood pressure drops 10 to 20% during sleep. But sleeping in positions that restrict breathing, elevate core temperature, or misalign posture can blunt this dip, forcing your vessels into overdrive overnight, and accelerating vascular wear, rolling out combined. These effects can transform a restful night into a silent threat. 3. The shocking sleeping position. So, what posture alarms the doctor? Research points squarely at sleeping flat on your back, supine, without adequate head or neck support. This position frequently worsens apnea episodes in stroke-prone, later life populations. Further, excessive pillow elevation, or conversely, no pillow, can strain the neck and compress vertebral arteries, impairing cerebral blood flow. Many seniors believe back sleeping is supportive. But this discovery shows it can increase the risk of nocturnal brain ischemia or silent strokes. That unassuming posture that feels comfortable might be quietly damaging your circulation. Evidence base and scientific context. While some insights come from clinical observation, studies reinforce the concern. Sleep apnea and stroke correlation. A foundational study showed moderate to severe sleep apnea raises stroke risk nearly fourfold, particularly in older adults. Sleep disruptions increase strokes. Medical News today reports that poor sleep quality, whether too short or too long, can elevate stroke incidence up to fivefold, though they caution this is associative rather than directly causative. Specific positional risks. Para et al., 2008, and others describe how certain positions exacerbate airway collapse post-stroke. Separate literature describes artery compression from cervical misalignment during sleep. Together, these point to sleep posture being a meaningful, modifiable factor in stroke prevention, especially for seniors. 5. Safer rest, recommended positions. Fortunately, there are healthier alternatives. Side sleeping, left lateral. Sleeping on the left side improves blood flow to the heart and brain, enhances lymphatic drainage, and reduces acid reflux. An added bonus, since reflux links to vascular inflammation. Right lateral and fetal positions. Both strengthen airway patency and reduce apnea severity. The curled, fetal posture also aligns the spine and eases breathing. Supported semi-Fowler or inclined position. Adjusting the upper body with a wedge pillow or adjustable bed supports breathing and reduces heart and lung strain, especially good for those with heart or respiratory issues. In any case, side sleeping often emerges as the safest and most effective stance for both breathing and circulation. 6. A holistic approach to nighttime stroke risk sleeping position is important, but it's one part of a larger picture. Prioritize sleep quality and duration. Both too little less than 6 hours or too much greater than 9 hours can raise stroke risk. Avoid bedtime triggers. Late meals, excessive screen time before bed, or falling asleep without medications, if prescribed, can disrupt blood pressure patterns and elevate risk. Fix underlying sleep disorders. If apnea is suspected, seek assessment and treatment, perhaps with CPAP, to lower nocturnal blood pressure surges. Maintain vascular health. Manage hypertension, diabetes, cholesterol. These conditions worsen vulnerability when combined with poor sleep. 7. Practical next steps for safer sleep tonight. Shift to side sleeping, especially the left lateral position. Use supportive pillows, one for under your neck and another between your knees to keep alignment. Avoid back sleeping if you have apnea risk or poor sleep oxygenation. Treat sleep apnea seriously. It's one of the strongest modifiable nocturnal stroke risks. Steer clear of late, heavy meals and electronic screens close to bedtime. Ensure restful duration. Aim for 7 to 8 hours of uninterrupted quality sleep. 8. Small shift, big impact. As a neurologist, uncovering the risk of back sleeping without support in seniors felt like a revelation and a call to action. Stroke can strike silently while you sleep, but one simple change, how you lie down, could drastically reduce that risk. It's a small tweak with potentially life-saving consequences. For seniors and caregivers, don't dismiss sleep posture as trivial. Reevaluate blanket safety habits, encourage healthier sleep positions, monitor for apnea symptoms, and ensure a restful, supportive sleep environment. By sleeping smarter, you aren't just resting, you're protecting your brain's future. Conclusion: a wake-up call that could save lives. As a brain doctor, I've seen the devastating effects of stroke far too often, many of which could have been prevented with better awareness and earlier action. What shocked me most in recent years wasn't a complex medical discovery or a high-tech innovation. It was something incredibly simple, something that most of us do without a second thought every night: our sleeping position. For seniors in particular, stroke risk increases with age due to natural changes in the body, narrowing arteries, slower circulation, and greater susceptibility to conditions like high blood pressure or sleep apnea. But now we know that certain sleep positions, especially sleeping flat on your back without adequate neck support, can make that risk worse, silently and consistently. This position can restrict airways, worsen sleep apnea, decrease oxygen supply to the brain, and in some cases, even compress the vertebral arteries that supply critical blood flow to the brain. When these issues happen night after night, the cumulative impact can lead to a much greater chance of having a stroke in your sleep, something we once thought was rare, but now understand is more common than previously believed. The good news? This risk is highly preventable. By making a conscious change to how you sleep, favoring side sleeping positions, especially the left side, and using pillows to support spinal alignment, you can improve oxygen flow, reduce pressure on key arteries, and significantly lower your risk of a nighttime stroke. But this isn't just about changing sleep posture. It's about treating sleep as a vital pillar of health, not just a passive activity. Quality sleep can improve cognitive function, stabilize blood pressure, reduce inflammation, and protect the vascular system that keeps your brain alive and functioning. For seniors, caregivers, and loved ones, this means being intentional about creating a safe, healthy sleep environment every single night. So, what can you do starting tonight? Avoid backsleeping if you suffer from snoring or apnea. Use ergonomic pillows to maintain neck alignment and reduce strain. Speak with your doctor about a sleep study if you experience excessive fatigue, choking during sleep, or irregular breathing. Keep your room quiet, dark, and cool to promote uninterrupted rest. Prioritize a consistent sleep schedule to support your brain's natural rhythms. Ultimately, stroke prevention doesn't always require complicated medications or invasive procedures. Sometimes it begins with something as simple as how you position your body in bed. This may seem like a small adjustment, but for seniors, that shift could be the difference between a peaceful night's rest and a life-altering medical emergency. Let this be a wake-up call for yourself, your parents, your grandparents, or anyone in your life who might unknowingly be putting their brain at risk while they sleep. Because sometimes, protecting your health starts by turning to your side and turning the odds in your favor.